Hello friends, welcome to the new session of Pharmacognosy. Today we are going to start with the first chapter, Introduction to Pharmacognosy. Myself, Miss Malvi Rajendra Bhavsar, lecturer, Kikeva Institute of Pharmacy, Nashik. So content, student will learn pharmacy and pharmacist, what is pharmacognosy, what do pharmacognomists do, scope of pharmacognosy and history of pharmacognosy. Pharmacy and pharmacist. Pharmacy refer to the profession which is concerned with the handling of all aspect of chemical substance referred to as medicine or drug. These include knowledge of a source, whether natural or synthetic, physical and chemical properties, good and bad effect on living organism, including man, dose and dosage form, formulation, compounding, manufacturing, quality control and assurance, storage, sale, and finally law and ethics governing the manufacture, import, export, and usage of drug or poisons. Now, pharmacist. Pharmacists, also known as druggists, are a healthcare professional who practice in pharmacy, the field of a health science focusing on the safe and effective medication use. The role of pharmacist has shifted from the classical lick, stick, and pour dispensary role, that is, lick and stick the label, count the pills, or pour liquid, to being an integrated member of healthcare team directly involved the patient care. They undergo the university level education to understand the biochemical mechanisms of action of drug use and therapeutic rules of side effect, potential drug interaction, monitoring parameters. This is method to education in anatomy, physiology and pathophysiology, professional interpretation and communication of this specialized knowledge to patient, physician and other healthcare providers that are function with pharmacists provide and are central to provision in the safe and effective drug therapy. Now, what is pharmacognosy? The term pharmacognosy was first coined and used by C. A. Sadler in 1815. In a small book he wrote on a crude drug entitled Analecta Pharmacognostica. It was derived from two Greek words, pharmakon, which means drug, and gnosis, which means knowledge, or gnosko, which means to acquire the knowledge of. Thus, the literal meaning of pharmacognosy is knowledge of a drug or to acquire the knowledge of drug. Thus, pharmacognosy may be defined as objective study of a crude drugs and related substance of a natural origin to acquire the knowledge about their natural and properties. It may also be defined as an applied science which concerned with acquiring knowledge of all aspects of crude drug and other natural substance of pharmaceutical importance by application of various scientific disciplines. According to American Society of Pharmacognosy, pharmacognosy is defined as the study of physical, chemical, biochemical, and biological properties of drug substance, or potential drug or drug substance of natural origin, as well as the search of a new drug from natural source. In other words, it may be said that pharmacognosy is an important branch of pharmacy which deals with the scientific study of structural, physical, chemical, biochemical, and sensory character of crude drug and related substance of plant, animal, and mineral origin. It also includes a study of their history, distribution, cultivation, collection, identification, preparation, evaluation, preservation, use, and commerce. Now, what do pharmacognosist do? Okay, they will first isolate and characterize, means and characterization of active constituent present in crude drug. Then, characterization of pharmacology of crude extract and active constituent. Third process they do is evaluation of quality of natural medicines. Then interdisciplinary relationship ethnobotany and ethnopharmacology. Scope of pharmacognosy. Pharmacognosy occupies an important place in the pharmacy as it deals in the collection, identification, preparation, extraction of large group of drug obtained from the natural source which are used both in orthodox and traditional medicine. Then, the knowledge of the action of a drug can be utilized successfully only when identity, physical nature, and chemical constituent of drug are well known, and pharmacognosy supplies this information. Solubility, reactivity, stability, toxicity, dosage availability, purity, yield, method of isolation, purification, and identification of the chemical of natural origin are studied in pharmacognosy, which supplies the general information about them needed by all practicing pharmacists. Thus, pharmacognosy, the science of drug of a natural origin, has become a discipline of increased significance in the curriculum of pharmaceutical education. In fact, pharmacognosy formed the basis of which other branches of pharmacy developed. Pharmacognosy, pharmaceutical chemistry, and pharmaceutics are all manifestation and ramification on this basic science of drug. Price of pharmaceutical product containing natural substance is influenced by the method of cultivation, curing, drying, and assaying of the ingredient, which are dealt with in pharmacognosy. In addition to the various branches of pharmacy, pharmacognosy is closely related to botany and plant chemistry. By the fact that both of them developed as a result of man's interest in plant of source of food and medicines. Pharmacognosy also shares some ground with biochemistry, physiology, enzymology, food technology, and number of other fields of science. This wider scope of pharmacognosy entitles pharmacognosist to specialize in taxonomy, anatomy, morphology, phytochemistry, cultivation and conservation of medicinal and poisonous plant. Then history of pharmacognosy. History of pharmacognosy can be regarded as history of pharmacy and medicines because pharmacognosy had its origin in health related activities of most primitive human races of remote past. The process that contribute to early man's search for the cures and selection of the medicament include following: guesswork, that is application of intelligence or natural institution; trial and error, that is try and then discard if not useful or repeatedly use if found beneficial. Curiosity and search of food contributed considerably to this knowledge about the medicinal and edible plant and their virtues. Signature of nature, that is superficial resemblance between the plant part and affected organs or some symptoms of ailment, also guided the ancient man in selection of his drug. Observation of animal instinctive discrimination between toxic and palatable plant might have also helped primitive man to choose those plants that were beneficial from nutritional and medicinal standpoint. The healing power of some plants were undoubtedly discovered by accident. Then the Chinese pharmacopoeia, the Pansao, written by Emperor Shen Nong, written between 3000 to 2730 BC and appeared around 1122 BC, appears to be the oldest pharmacopoeia on the earth. These treatises include recipes and therapeutic use of many Chinese traditional medicine. Babylonians, about 3000 BC, appear to have been aware of large number of medicinal plant and their medicinal property. Some of plant they used are still almost in the same manner and same purpose. As evident from Papyrus, written in 1550 BC, the ancient Egyptian process by understanding of human anatomy and good knowledge of medicinal plant used for the hundred of plant and animals. Many of that present today important drugs like opium, pomegranate, castor oil, aloe, onion, many essential oil, bile, lard, and many other were in common use in Egypt about 4,500 years ago. The earliest plant medicine used in Ayurvedic system were described around 1200 BC with a list of 127 plant. The practice of medicine use in medicinal plant also nourished during the Greek civilization when many historical personalities practiced herbal medicine. The first personality was Hippocrates, a physician regarded as a father of medicine for his contribution to human anatomy and physiology. He is also known to have a collected and identified number of medicinal plants and practiced herbal medicine. His Materia Medica consists of 300 to 400 medicinal plants. Second personality was Aristotle, a a philosopher recorded the property of more than 500 plants of medicinal importance. Dioscoride, a physician, published 5 volumes of book entitled De Materia Medica in 70 AD. This encyclopedic work described more than 600 medicinal plants, including their collection, storage, and uses. Then Galen, he was a Greek pharmacist, physician who described hundreds of recipes and formulation of medicinal preparation containing both plant and animal ingredient. These recipes and their method of preparation and his their observation on medicinal plant have been recorded very accurately in as many 20 books. The present day canonical pharmacy is a manifestation of this method and recipe, and the term is used to attribute him. An ancient Arabian physician and emperors that possess vast knowledge in medicinal plant, they contribute enormously development of medicine based on the Greek system. Ethnobotany, it is a study of relationship between people and plant. Field includes study of plant as a medicine alternative method for healing, as a wild food, as an agriculture crop, modes of transport, as a clothing, and in religion ceremonies. And ethnopharmacology is scientific study correlating ethnic group, their health, and how it is related to the physical habit and methodology in creating the use of medicine. This is Ebrus Piper Papyrus, which was written by Egyptians. The author of Antiquity, Hippocrates, was father of medicine. This is the Materia Medica, which contains 600 medicinal plant. Diascoride. Thank you very much, friends, for a patient listening. Thank you.